Kolebu, Ghana's leading hospital, Abna Mensah goes through what has become one of the most dangerous experiences in her life, giving birth. As many as 700 women in every 100,000 die from giving birth or during pregnancy. Thankfully, Abna delivers safely. Lydia Asari did not. Her father and sister recollect. Lydia was a healthy mother of 3, eking out a living as a petty trader till complications set in during her 4th pregnancy. Lydia was rushed to the operating theatre, but there was a problem.
Just because she's a woman and she goes through a certain natural reproductive function, she has to die because she can't access healthcare facilities or because she bleeds.
Unacceptable.
Maternal death is a very painful event.
The rate in Ghana is just too high.
Most of the causes are preventable.
Pregnancy is not a disease. It's a physiological, normal process that must not lead to death.
Who is dying mostly? It is mostly poor women in poor communities.
Dawn breaks over the village of Palbi in northern Ghana. Iman Mahamadou lifts his voice and prays for a good day. Shawana, his daughter, is also up early. She's 7 months pregnant and due for a checkup at the local clinic. Before she goes, however, she has groundnut biscuits to get ready for the market. Shawana's parents decide to accompany her to the clinic. She lost her first child and she has not been well lately. Her father also lost his first wife during childbirth. It's an anxious time for the whole family. Shawana is attended to quite quickly. Her parents look on anxiously. In the examination room, the midwife takes Shawana through her checks and reassures her. It all seems fine, for now. Abiba Hussaini has run this clinic for many years now. She keeps a cheerful demeanor, but it's not hard to detect the many challenges she faces daily.
The bed is rusted due to the bleeding and other things that go under it. You can see it by yourself. We need 2 delivery beds. We also need a resuscitation table.
The clinic has no running water. Everybody here relies on buckets of water.
When I'm delivering a woman, I have to walk out to wash my hands, come back here and attend to the woman.
Balbi Clinic is not equipped for emergencies. That is taken care of at the district hospital 30 miles away. There are no ambulances here.
We have just 2 motorbikes. We normally find it tough when we are referring our mothers. Salga Road is bad. We prefer referring our mothers to Tamale. Baba, you write carefully. You support them. Bye-bye. How Sanu Sanu?
Abiba is about to deliver a baby, but one challenge seems to get her down. No matter how hard she tries, power cuts. The lights have gone out again.
This is the only way I can help her. Kuma.
The clinic's solar panels barely work during the raining season. Thankfully, there's good old torchlight and lantern. Down the road is Bunjai Clinic. Midwife Adana and her assistant race back from a field trip, making sure that the bike does not run out of fuel.
There's always a problem with fueling and service of the bike. We cover about 16 communities. We do deliveries here we render family planning services too. Yes, but it's just one room that we do everything.
A single room, a single bed for all categories of patients.
An antenatal mother comes in. Usually we just spread the mat on the floor and then need to kneel to palpate them. And it's so tiring.
Help may be around the corner.
This is our new structure that the communities have provided. We are going to use one for the maternity ward and then one for detention of our clients.
The uncompleted building is already in use.
I conducted the labor here. Finally, I have to bring one of the mats inside here for her to relax. And she doesn't know anybody around. She came with a small boy who brought her on a bicycle.
Salaga Hospital, where midwife Adana refers most of her patients. It is the largest in the district, but it struggles daily to cope with patient numbers and outmoded facilities. Dr. Sarkodie has worked here for years. We ask him a few questions. What is the population of Salaga?
220,000.
How many doctors?
One medical doctor. You know, it's outrageous. It's just extremely difficult.
Tamale Central Hospital. The acute shortage of skilled staff is all too apparent here too. Dr. Patrick Bampo is the medical superintendent.
Saturday like this, we had one midwife working from 8 in the morning to 8 in the evening.
Domar Presby Hospital. Peter Jesse, the principal nursing officer, is on his daily rounds. He makes a regular stop at the antenatal department where the nurses work under quite severe pressure.
Only one midwife and one ward assistant in the maternity.
That weekend, that midwife had what is considered here a not too hectic spell of duty.
18 deliveries and then 5 CS.
At the moment, our staffing situation is really very poor. You may have a health center superintendent who is a medical assistant, no training in maternal health. And in most of these facilities, it's only a midwife that might provide the care. In terms of doctors, about 80% are in Accra and Kumasi, and the rest go to the rest of the country. I'm sure the nurses are not far behind, and the pharmacists are even worse.
We travel again to the north of Ghana, where the vast savanna includes many isolated villages and remote settlements.
Access to healthcare is really a problem. Apart from distance, also there's a cost to get into health facilities. In most places, the easiest way to get to health facilities is on a market day when there's a vehicle that arrives and then you can go.
Salaga to Kafaba. One of the worst roads in Ghana I can see. If somebody is seriously sick, without the market truck, we have to rely on the tipper truck. If the tipper truck is not in town, then we go on motorbikes.
During the raining season, the roads get flooded, cutting off many communities. Reaching a hospital during the night is even more daunting.
As if by nature designs them, most women tend to go into labor and deliver in the night. And at that time, there is really no way to get into a facility. So what would have been appropriate would be for a woman to be able to call for some emergency support. The truth of the matter is that people are taken into health facilities on a motorbike, bicycle, on a donkey cart, even in a wheelbarrow. That's the reality on the ground.
Kafaba, an isolated village on the banks of the Black Volta. A pregnant woman is in distress and needs urgent attention. She's rushed across the river to a clinic where midwife Brima recollects a similar case.
The woman had been an attendant, and I advised her not to deliver at home. There was no way the woman could have delivered.
That notwithstanding, the cloth is spread on the floor and the medications applied only to confirm the obvious. They cannot help.
You can't get in touch with anybody from here. The network comes on and off. Everybody's phone is off.
On this note, I have to carry this woman on a motorbike. Look at the distance. It's about 20 miles. This woman was struggling. I was also struggling with her. She was admitted, and the following day, this woman passed away. She died.
We need to have holding homes to take care of people who are so far away from health facilities.
Holding homes can definitely help isolate communities, but one needs the cooperation of local midwives. Their role within health delivery has, however, become controversial. To work or not to work with them is now a major policy dilemma. Professor Binka still thinks they have a role to play under supervision. Charles Abugre goes further. He was part of the team that piloted a new health model in northern Ghana during the late 1990s. The focus was decentralization, working with the community's own resources.
The greatest health resources of the local community are those who provide informed health services informally. In the case of reproductive health, it was traditional midwives and attendants. The role that this program gave to traditional midwives and attendants was not simply delivery. They were to act as a focal point for community health care.
In the nearby village of Isutiano, it's celebration time for mothers from miles around, and their heroine, Grace Pukia, midwife and priestess, offering an empowering mix of spiritual guidance and practical midwifery. Their mutual respect and trust build into confidence, which makes all the difference during delivery.
Doctor dan di bia kohoda na masa ne ye sitia a okrokrom pawachew yero hu miawani aka kakra bi doctor so ndi bia koho a nko ye kra ne nani sokra adamoja mi se mba ye odi akira nko bebu makun nso de mpachew miawani nsoro mrekwa mpachew saa ni nyame ye madoma ntinwo ye ntine ama mani nje se meko doctor esanse doctor bia ni ho bejejo so wo yo wayi ni bia njina ni bia bejejo so we so de ojeje yo so payachew me ye tinwo faye ho faye ba
ne doctor oya tete oya how so de ye ba ye nya na ho blase so ni oya ye tan de kura ba ko ne se awo no ye mlem otim bua ya kwani nyina so ma ye tim wontem doctor anka beja wa to ko se wa tama abewo.
Throughout the country, dissatisfaction with hospitals runs deep. We met several women who complained bitterly about rude health staff. Complaints were particularly common amongst poor rural women. The Ghana Health Service takes these complaints seriously. Reducing maternal deaths is critical to achieving the United Nations Millennium Development Goals. It demands a range of coordinated interventions, renewed focus on family planning, skilled care and delivery, emergency obstetric care, targeting poor communities and effective monitoring, and above all, sustained political commitments to address the issue. The Asaris leave home for a familiar but painful destination. It is a journey that takes them along the red, dusty road to that special place in their hearts. Is Shawana ready to have her baby? Will she return home with her bundle of joy? Or will her family, like the Asaris, make her graveside their familiar and painful secret?
Yes, sir. Yeah, then about see. And I'm more bro, sister. Would you say?